Something that caught our eye in our email inboxes here at Channel 2 this morning, a release from the doctors at UBMD Pediatrics sharing an urgent call for parents of any child 5 and older to get them vaccinated against COVID. In Western New York, less than a third of kids in the 5 to 11 age group have gotten at least one vaccine dose. For those 12 to 17 who have been eligible a lot longer, it's still just 6 out of 10. That is compared to much higher vaccination rates for other age groups, as you can see right there. We know that with Omicron, we're seeing a lot more children end up in the hospital as a result of this disease, although to be clear, kids are much more likely to have a mild case if they do catch the virus. Let's discuss all of this now with Dr. Stephen Lipshultz, president of UBMD Pediatrics and chair of pediatrics at UB's medical school. Sir, it is great to have you on the show tonight. And let me just first ask you about timing. Why put out this kind of urgent warning that you did to parents earlier today?
Well, one of the things that we're seeing right here in Western New York and in Buffalo is that for children that have underlying health conditions, many of these are children that we follow with chronic lung disease, diabetes, sickle cell immunodeficiencies, cancer, and the like. These children, when they do become COVID infected, oftentimes they're at greater risk for complications. And what we're seeing here is a high percentage of the children that need to be hospitalized are children in this setting that have underlying health conditions. And, and more of these children with underlying conditions are being admitted to hospitals for severe disease. And so what we want to do is reduce the chance that your child may have a severe illness and hospitalization from a COVID infection. And that's why, as a result, working in conjunction with New York State Department of Health and Erie County Department of Health, now at UBMD Pediatrics, where we see a lot of children with underlying health conditions, we're now able to give these children and their families COVID vaccine, as well as other vaccines to reduce this chance of getting the greatest risk for complications and hospitalizations.
Doctor, we showed the vaccination rates among different age groups there in our region. And again, for those 12 to 17, it's at about 61%. If you look at the whole state, though, it's like 75% because rates are so high down in New York City. Why do you think our region is so far behind on that?
I think that we are geographically a little bit more challenged, and for the pediatric patients, it's been something that our community of pediatricians have been very, very dedicated in our health department to getting this out. I think that it's lower because of the region that we're in and the availability and access. And that's why increasing that access, especially to our highest risk patients, those with significant underlying health conditions, which what we're seeing in Western New York right now is the group that, again, is having the most severe disease and the greatest complications and the highest hospitalizations, becomes critical. And the same is true downstate in New York City, even with higher vaccination rates. For those children with these underlying health conditions, some of which I mentioned, or children that have neurodevelopmental disorders or kidney disease or cardiac disease, they're the ones, even with vaccinations, that are still at highest risk for more severe disease. But clearly getting vaccinated and getting vaccinated now certainly improves the chance of these children not progressing to really get very, very sick the way we're seeing in those that are hospitalized.
Dr. Stephen Lipshultz is president of UBMD Pediatrics and also chair of pediatrics at UB's medical school. It is such an important topic. We really appreciate you coming on and hope you have a great weekend.
Thank you. Really appreciate it.
All right, and hope you everybody at home have a great weekend as well. Go Bills. We'll leave you with our text line number, and we hope you'll stay right there because Channel 2 News at 6 is up next.